Currently, heart failure is the #1 discharge diagnosis in the country. More patients over the age of 65 are hospitalized for heart failure than any other disease in any other organ system. Because of that, it really is defined now as an epidemic. Heart failure is really the end stage of all the various kinds of heart disease, whether that be coronary disease or valve disease or infections. Occasionally, heart failure patients can present with a sudden onset of fluid retention and shortness of breath, but that's not the typical presentation. Most patients will present to their primary care physician or perhaps their cardiologist with just complaints of progressive fatigue, progressive shortness of breath with exertion, and they don't really recognize that there's an underlying disease process that frankly is treatable. It's getting your blood pressure under good control, it's keeping cholesterol under good control, it's making sure that we don't put on too much weight and develop obesity, it's a regular exercise program to keep our cardiovascular system fit, it's great control of diabetes. Those are the things that help prevent heart disease, which then prevent heart failure. What we've been able to do over the years is to improve our care coordination. And what that means is that we have improved communication. Heart failure patients or patients with heart muscle disease really require a whole team to care for them. And that includes not just the cardiologist, but also their primary care physician. Other members of that team oftentimes will include a pharmacist, a nurse perhaps that specializes in heart failure, a dietitian, an exercise physiologist. So at the time of an office visit, for example, we send the electronic notes to the whole team. We call other members of the team about any changes in care. And anytime we have communication with a patient, then we communicate that to the team as well. So this improved care coordination, this team approach, really helps make treatment much more successful. We can help people not only stay healthier longer, but we can also, once they get the disease, we have so many things that we can do for them. We can treat a lot of their problems with medications and help them live longer and healthier lives. We can stent arteries, we can bypass arteries, we can fix valves with catheter devices, we can replace valves. We can, frankly, put in artificial hearts, or if the heart gets diseased enough, you just take it out and put in a new one. There are so many opportunities here for patients that to get up every day and come to work, it's just another opportunity to offer some of these therapies to patients and help them get out of their symptoms and do the things that we're supposed to do as human beings that are part of families and part of society.